Okay, so I've put this video together to help you pass your anaesthetic final vivas. What I've come to realize is that, like many things in life, doing a viva is a skill. You can be perfectly competent at giving an anaesthetic, but not have adequate skills to actually pass your viva. This tutorial and my viva skills training sessions are designed to address this potential shortcoming in your training. So before we continue, I'd like to give a shout out to a few people. Dr. Susie Miles, who worked at Liverpool Hospital when I was sitting my final exams and whose techniques I borrow from heavily. Dr. Alan Sexton at Westmead Hospital, who so generously donated his time to generations of trainees trying to sit their Part 1s and pass them. And Dr. Blair Munford, who did the Part 1 tutorials at Liverpool Hospital. So let's begin by looking at the ANZCA website and the previous exam reports and see what they tell us. So here we have the ANZCA website, and point 4 here with the anaesthetic vivas. You're going to have 8 vivas, 15 minutes in duration. Vivas commence with 2 minutes of reading time, followed by 15 minutes of the questions. And here it's really important to note that the aim is to create a realistic patient scenario that evolves, progresses, and tests the candidate's abilities at multiple points in this timeline. Okay, and in order to get a viva, you need at least 40% in your multiple choice and 40% in your short answer exam. So going over to, this is 2018, the second sitting. This tells us that the reason that the examiners are doing this is to explore your ability to make clinical decisions based on sound judgment and experience. So really what they're testing here is your judgment and your experience. They also hint here that you need to be structured in your approach to situations and flexible as well. So sometimes the examiners will actually try to help you get through the scenario and may, change things as you go. So you're also expected to be reflective and take a consultative approach. Now, better candidates will be more adept at communicating their actions in, again, going back to structure, organized and logical way. They will be able to make they will have a clear ability to make decisions and communicate this. So if you're stuck not wanting to make a decision, sitting on the fence, you're at risk here. Here they make it explicit that the standard that they want from you is of an independent specialist anaesthetist. And conversely, the poorer candidates, they're disorganized, unable to make clear clinical decisions. They overlook obvious detail that's provided when trying to communicate their approach to a specific problem. Okay, so that's 2018 second sitting. 2018 first sitting, probably very similar. Let's have a look. Test knowledge, decision making, complex situations, conflicting demands. So resource management is probably going to be part of your scenarios because that's what you're expected to do as a specialist anaesthetist. So each viva contains 3 main areas, and so this is what you'll find in the 15 minutes, that it's actually divided into 3 5-minute sections. Patient scenario, same initial opening questions, so that's your stems. And there's a crisis that should be diagnosed and managed as per relevant guidelines. So candidates perform well, so this is important. They're reflective, express themselves clearly and confidently, and they answer questions in a realistic manner. Okay, so that's 2018. 2017, again, knowledge, decision making, complex situations, 3 main areas, same initial opening questions, crisis, reflective, express themselves clearly, confidently. So this is basically the same as the 2018 session 1. Okay, here we go. This is 2017 first sitting. This looks exactly the same. Here we go. Candidates should practice reviewing the information provided in the stems. And this is what we'll be doing in the Viva practice sessions. So I think this is actually a really important thing which people miss out on, and something that I emphasize, and we'll go through it probably in a subsequent video, but reading the stem and making full use of that 2 minutes. So here we are, 2016 second sitting. Again, knowledge decision making. And there's nothing new in that report. Knowledge decision making. This is what, 2016 first sitting. Again, reflective, express themselves clearly, confidently, answer questions in a realistic manner. So, you've got to be realistic. (2015) second sitting. Knowledge decision making. Okay, nothing further there. No information there. 2014. So here they've got the aims. To apply principles of acceptable safe practice. Sound clinical judgment again. Plan and prioritize clinical actions and anticipate sequelae. So being able to, I guess, anticipate what's going to happen as a result of what you do is part of all of this. Organization and communication skills. So you get extra marks if you're adaptable to changing clinical situations. If you're rigid and only can go down one track, you're going to get marks subtracted or potentially marks not awarded. And they want you to use scientific principles and express your thoughts clearly. And then this is May 2014, so this is, I think we've been through 10 papers. And this is the last one, and that's exactly the same. So, in summary, what you'll find there is looking at 5 years worth of exam reports. Basically, the examiners want you to be safe, they want you to be sensible, they want you to be able to express yourself clearly, they want you to be structured in your answers, and they want you to show a little bit of flexibility, so not to be too rigid. So out of all of that, we'll move on to the next video, which is going to be built around breaking down passing a Viva into a few different skills.